trend of his
Sao mang được?
university.
Chắc mấy làm ngay nước
So
sạch
study
chìm.
here.
Đồ phục
So I'm
đồ
coming from
khao,
Tokyo,
đồ
Japan.
Anh.
Ngay nước sạch chìm.
Cricket.
Nhưng cũng thể
Thank
thao
you.
mà
I
mình
also
cũng
have
thao ní khai tỏa kho tao bằng ngày mua để sao mà đẹp
this presentation.
Thôi, tất cả cô.
Giáo
So
viên
this is
replay
my
cho nằm.
CV.
ừ
So at first, I'm talking about the why
Để nâng lên là trong thôi.
there's suddenly
Sẽ để thằng
change.
zoom chặt với
But
thôi.
I'm buying which is better. It is really good for me for low sugar diet. So actually, why? I want to say, this is a progress in medicine in 80s and 90s. So anatomy, physiology, and nutrition, genetics, hormones, neurostimulations, and bacterial and such on. Progress in medicine is now, there was a really good time for doctors. So filled with a sense of being able to do anything. So believing that almost everything is medicine has been discovered. So but spleen and appendix healed because of the accident or inflammations, self-supplement, living nutrition, cancer should be removed at large. But medicine 21st century, emotions are subject of the research thanks to visualization of blood flow in the brain. And genes, not just DNA, but also RNA are analyzed. Fat and muscle cells exchange message and substances, and good bacteria may also determine human personality or emotions. So, have you ever seen such a kind of pictures? So this is 51 years old female. She is vegetarian, and she is not vegetarian. So you can find the difference. So the human body was far from complex than we thought. So theories about medicine and health are still changing in the future. So we should get evidence. So physicians, almost people think we are the health expert, but we are in a disease expert. So we have to thinking about this. So this is a changing market. So health and beauty, and there is normal health insurance and anti-aging service, and wellness, and cosmetic dermatology, and cosmetic surgery. So there is so many market. So we have to focus on which market we should focus. So what is the task of research? Substantiation. So solving problem without answers is our object. So if you use engineering in physics, so you can prove material formulas. And if you focus on pharmacy, we can use chemistry. And if you focus on medicine, so we can use such a kind of statics. So this is my clinic. In my clinic, there's more than 40 laser devices. And what comes to mind when you hear the term of anti-aging clinic? Products, hyaluronic acid, threading, laser, and rejuvenating. But I think there's a big difference between these ones. So these three are creating a young face, and these one are rejuvenation. So it's really difficult to tell about, but it's totally different. So I want to, recently in Japanese, we are focused on not about creating a younger face, but using using lasers and rejuvenation. So it is a really big difference between fake and real. So like this, this is fake. Fake. If you see such a kind of the android, you will see really beautiful, but it feels something uncanny. So yeah, this is a very important point. So if you see such a kind of the pictures, yeah, this is strawberries and this is tomatoes and this is synthetic. But if you see such a kind of the pictures, you will feel bad. So what laser therapy can do is rejuvenation of the skin, not removing a brown and red spot. Yeah, this is very important. So yeah, this is case report of the 44 years females. This is before and after, and this is before and after. You can find the difference between these ones. And our goal is concentrate on rejuvenation features, not on creating younger face. Goal is face 20% younger than the actual age. If she is in the 60s, we could make like 48. And she is like 80, we could make a 40 face. And she is 40, we can make 33. So this is a very important point. So in my clinic, there is 4 types of the treatment. So one is whitening of the skin, and one is tightening of the skin, and one is resurfacing of the skin, and one is lifting of the skin. And this is just 4 protocols. So if we focus on the resurfacing, so we focus on the collagen stream, these ones, lasers. And next, we do the whitening or brightening treatment. It is because of the color changes. We focus on the evidence. Elastic changes was coming from the dermis, so we use tightening effect. And for the fat treatment, so we use lifting RF and hyper and fibers, such as. So if you use just improving the appearance of skin, when he is 43 years, and he have changed like this after 12 years. So this is also 38 years to 48 years. So what I want to say is you should do like Tom Cruise. So he is in 20s, 30s, 40s, and 50s, and recently he get 60s. Yeah, but I think this is the best way. Yeah, probably you know this is Iceman. So he's the rival of the Tom Cruise. He's very famous actor, and he passed away last year. Yeah, but he used fillers and thread and other aesthetic devices. So for example, this is my face in the 20s, 30s, 40s, 50s. So yeah, this is a very good point to using laser treatment. So this is the positioning of clinic F. Clinic F is treat healthy people. Insurance covered clinic is treat sick people. So these are the difference. And I also talking about the laser treatment. So what are lasers? Laser is the name of laser is the device from the acronym light application by steroid emission radiation. So this is very important. So the past 50 years, so we have to focus on that, just on the papers. The next, so the engineering can make laser devices. So when appropriate, 1960s, so Theodore Lehman made laser devices in this period. He get a Nobel Prize in 1964. So after then, so laser application is really good and really big. So CDs, DVDs, and barcode readers, and fiber optic fibers, and communication, laser printers, laser processing machine, laser measuring instrument, and such a kind of laser devices. So recently, so one of the greatest invention in the history of the modern science is the man-made optical laser. So if we use laser treatment in medicine, so there is 2 types of using. One is application to the biometric acquisition. It's like the optical coherence tomography. And the other is application to modification, laser surgery, such. There is 2 parts. And so these are laser action in the 1990s. Probably these pictures. This is selective focus arrest theories, and this is theories. And in the engineering field, there are so many lasers like this. So if we are talking about the electromagnetic waves, there are so many than these ones. This is cosmetic wave, gamma rays, X-rays, and ultraviolet, and visible, and ultra infrared, and microwaves, and RFs. Then, so in 30 years, there is more than 10 revolution in energy-based medical devices. So at first, probably I got medical license 30 years ago. So there is just now lasers, and it was a long path. But Q-switch have invented and toning and Pico, and recently released Pico fractional. And there's another type of the energy-based medical devices like this. Okay, so talking about the formula whitening and brightening skin. So this is a normal skin of melasma. So you can see such a kind of the biologics. This is in 20s, and this is 30s, and this is 40s. So you can judge the difference. So the turnover, the speed of the turnover is decreasing in a age in a dependent manner. And if you use the laser treatment, such a kind of laser treatment, so you can change the difference. And next, so tightening of the skin. So this is very important point. So if you look younger, so the collagen and elastin band will be thickened. This is pre-treatment, and this is after treatment. So the new fibers are generated. And so sometimes we use just to focus on collagen stimulation. So there's wavelengths and powers. And we also use elastin proliferation. We always use such a kind of treatment. Recently, 12 years ago, this is a paper of the Stanford University. So, but probably you can find this is very important. Gene expression pattern is very important. Because so we have genes in our body, but genes have not appeared, so it's meaningless. So recently, I always using photobiomodulation. So this is revitalizing your skin nutrition. Nutrients. And formula 3, resurfacing of the skin. So we use for acne scars and liquid treatment. So if you use fluxer laser treatment, it is such kind of approach, these ones. This is my patient in the 50s. Probably you can find the difference using the fluxer laser treatment. And this is a force reduction using the fluxer laser treatment. And this is resurfacing of the face, 76 years old females, and you can change after the two treatment. There's a difference. And this is patient in 40s. You can find the difference, texture difference, like this. And formula 4, lifting. Lifting is very important for tightening of the skin. So definition of lifting is this is the lifting. Lifting is a plastic surgery for lifting facial tissues and improving the facial appearance. It's like a facelift. And tightening is really different. So tightening the saggy face by tightening the skin of the face and tightening the skin from the face to the neckline. So this is a point. So if you use such a kind of laser treatment and energy-based laser treatment, so this is the younger skin. This is muscle, and this is dermis and epidermis, and this is subcutaneous area. So if you get older, so you will be changed like this. So if you use laser treatment to tighten the collagen strand, you can find the difference like this. This is my patient, woman in 50s. We use lifting treatment, and yeah, you can find the difference. Next one, so application to the hair. So this is my new papers for application of the application of the hair. So this is my name. This is my name. Yeah, we use the single cell transcriptome analysis for fractional shield laser efficacy in treating mouse model operation. So probably you know. So if central dogma genome analysis. So we want to see the DNA, we use the genome analysis. Even if we want to see the messenger RNA, we have to use the transcriptome analysis. So this is a very important point. And acne scar treatment. So this is the before and after of the acne scar treatment. This is the before and after. And yeah, this is just a scar. This is just a scar. And we are talking about the peripocular treatment. So upper rate. So if we use the fraction laser treatment like this, this is after the treatment, and this is a few days after, 2 days after. And you can see the difference. 3 days, 5 days, 3 days, 5 days. There is a difference before and after treatment. So you can find the title of the ID. So next, this is also ID treatment. This is before and after. A few times, probably 5 or 6 times, using shield diffraction lasers. This is IPAC treatment. This is 32 years females. So you can find that these one will go using laser devices. This is 46 females. You can find the difference. These ones IPAC have gone like this, like this. So talking about the eye septates. So there is an eyeball. It getting older and older. So eyeball will be down. So this part will be forward, will be forward. So this is a very special septates. So this will be like this. So this is very point. And so this is another patient. So there's a big brown spot here. So probably you can find it's in here. And I do such a kind of laser treatment. You can see that there's no the brown spot have gone. So this is a body treatment. So this is 40 years female, and this is 41 years females. After using cryo. Probably you can see the different like this. The body treatment is very difficult to talking about. So, however, seeing such a kind of pictures. So this is what a perfect body like that. So it depends on who ask and where they are. So this is probably 10 years ago, website. So they asked designer from 18 countries to research and image to perfection of the perception of perfection. So this is the original image. So many of the designers changed the ideal body. So this is Mexico and Mexico and Peru, Luzon. So we will find such a huge changes like this. Yeah, this is very important. Finish? Finish? Okay. Okay, thank you.
Are there any questions from the audience? Okay, so without further ado, we'll now proceed to the next session. Thank you once again, Dr. Bukimoto. Our next speaker is Professor Anom Thaijitrojana, a distinguished dermatologist trained at Ramathibodi Hospital, Mahidol University, with a fellowship in dermatology from New York. He has served as a dermatologist and lecturer at leading institutions, including Mahidol University, the Institute of Dermatology, and Sri Willow University. Today, he will be presenting on the topic, Transform Your Acne Management, Customizing Treatment to Fulfill Patient Needs and